Good afternoon. My name is John Todd Surgeon,
I'm Hunter Lombard.
and right here is the rest of the OnCol team. OnCol is a digital ecosystem for experts, institutions, and communities. What we're doing here is we're seeking to create an extension of Mount Sinai's healthcare system that can provide supplemental materials to the public. This is important because the promise that the internet gave us when it first came out was that it would make people smarter and it would make them more connected. But in reality, it's done almost the opposite, right? It has given rise to the death of expertise and the rise to the miseducation, where you have the general population believing that they are qualified to make their own diagnosis just because they read something on the internet. Well, what we're trying to do here is to create an inclusive digital ecosystem that will allow patients to access information in a responsible way. OnCall will restore the authority that websites like WebMD and public forums have ended. It will integrate all levels of hospital communication, fostering comprehensive support networks, improve clinical trials matching, and increase investment in Mount Sinai using the HCAP surveys. Now we're going to start with a short demo of our product. The main feature of our website begins with our encrypted sign-up system that allows patients and doctors to log in and interact with each other in a safe and informative environment. From here, patients can go and use Medical Ease, which is a physician-translated supplemental resource in medical language made easy. Now this brings us to the community portal, which connects patients to a support network of clinicians, psychological professionals, and other patients. The final feature is OnCall Archive, which connects clinicians to each other, providing access to high-ranked published materials so that meaningful discussion about the implementation of treatments and clinical trials can take place. So what we're excited about is our future directions here. We can use HCAP scores to provide an easy avenue for quality improvement and investment in Mount Sinai. The thing is that reimbursement on a governmental level is doled out on HCAP scores, and we're trying to maximize that with this platform. And evidence shows that better patient-physician interaction improves the outcomes, and that's why OnCall is going to be a very, very valuable resource to Mount Sinai and other health systems in the future. Thank you.
So, what's the notion of the market? Give us a sense of who are the patients. It's not just. It sounded like it was about Mount Sinai, but who's the broader base of your customers?
So the target population for the first half or the first third of our product is everybody. So we want the encyclopedia of generalized knowledge in medicine to be accessible to the public.
What about the other 2/3?
The other 2/3 are our research is also going to be accessible to the public. They won't have the same rights as clinicians would, but they would most definitely be able to view the comments that clinicians would make on them. And then the last part, which is the community portal, that would only be accessible to the people inside of the system, such as the clinicians or the people who are the patients.
Okay, thank you.
Sorry. Clinicians are very busy people. How do you intend to get them to utilize the system when there are so many other applications out there, resources and so forth, such as UpToDate, that tend to gather these types of information together?
UpToDate is not indexed, and it's not as publicly accessible as it should be. And also, this is a one-stop shop. It combines all these things in one place, and it creates a hospital-like environment outside of the hospital. It extends the hospital.
How do you address any issues with liability if people read this and
All the
They make-
patient information is encrypted. It's given a randomized user information. You're not allowed to sort of like name yourself. And we don't connect it at all with medical records.
okay?